Today we are going to talk about ectopic pregnancy. Ectopic pregnancy is implantation of a conceptus outside the normal uterine cavity. Incidence are like 1% from all the pregnancies. Possible sites are fallopian tubes has 95% of chance, and other than that ovaries, peritoneal cavity, cervix are the possible sites. In fallopian tubes, ampulla has the 74% of chance to get implanted. It causes the maternal death. There are few risk factors for ectopic pregnancy, such as tubal diseases due to PID, pelvic inflammatory disease, previous ectopic pregnancy, previous tubal surgery, use of assisted reproductive techniques, history of subfertility, endometriosis, and intrauterine contraception devices in situ. Any female in reproductive age group presenting with abdominal pain and bleeding per vagina with period of amenorrhea always should exclude an ectopic pregnancy. Main symptoms are pain, lower abdominal, and which is classically unilateral, and there will be vaginal bleeding. Amount will be small. If the ectopic is ruptured, shoulder tip pain you will develop. It's due to diaphragmatic irritation from blood, and patient will collapse if the ruptured and the blood loss is very high. And also, if it is not ruptured, it can be asymptomatic. Signs: uterus can be normal or lesser than the period of amenorrhea, and when you do the vaginal examination, you can see cervical excitation, and also you can see adnexial masses or tender adnexia, as well as peritonism in ruptured ectopic due to intra-abdominal blood. How do you diagnose it? First, you have to diagnose pregnancy. Probably you will do it via the urine HCG. If it comes as positive, and also from the ultrasound you don't see intrauterine sac, you go for beta HCG level. If the beta HCG level is more than 1500, there should be pregnancy somewhere. And also, if you don't see the intrauterine sac, so you have to suspect there must be ectopic pregnancy. So what are the ultrasound features of ectopic? Presence of extrauterine sac with the fetus, or presence of an adnexial mass, presence of free fluid in pelvis with no intrauterine pregnancy, and empty uterine sac with serum beta HCG is more than 1500. If serum beta HCG is less than 1500, and intrauterine pregnancy may not be seen by ultrasound scan, so you have to repeat the serum beta HCG in 48 hours. If a viable intrauterine pregnancy is present, this would be doubles. If not, always suspect an ectopic pregnancy. And you can go for laparoscopy, which is gold standard but used only when diagnosis cannot be made clinically and other investigations. So you can manage this in three ways. First one, expectant, and medical, and surgical. Expectant management only for patients who are hemodynamically stable and asymptomatic. You have to follow up with serum beta HCG levels, repeating every 48 hours until it becomes lesser than 5 international units. Medical management, you can use methotrexate, which is folic acid antagonist, which inhibits DNA synthesis in trophoblastic cells, and this is only for patients with minimal symptoms. If there's no evidence of rupture, and patients who are hemodynamically stable, as I suggested earlier, and patients who are with good compliance, you have to follow up with serial beta HCG levels. Surgical management would be laparoscopy in unruptured or ruptured but hemodynamically stable patients. Advantages are it's minimally invasive surgery, and patient gets the quick recovery, and there will be less adhesions and less blood loss, but the disadvantages would be costly. And if you can't go for laparoscopy, in case of hemodynamically unstable or no facilities for laparoscopy, you have to go for laparotomy. You can do surgically either salpingectomy or salpingostomy. Salpingectomy is done in patients whose the other fallopian tube is function. Salpingostomy is done where the patient is having non-functional fallopian tube on the other side. Patient preparation: 2 large bore IV cannula inserted, either 14 gauge or 16 gauge. IV fluids will be given, and you have to cross match 5 units of blood. Patient would be kept fasting for 8 to 10 hours and inform seniors, theatre anesthetists. So this is about the ectopic pregnancy. Thank you.